Today it will be a very good day for us as podiatrists, as doctors, for the first international podiatry conference here in Dubai. I want to say welcome in Dubai for all our guests and for all our speakers and for all who is in the hall.
I'm gonna like to invite our first speaker today, Dr. Shadin. Thank you, Dr. Shadin.
It's really interesting. This is the first conference of podiatry I attend, and it's really nice to talk more about skin disease that affect the feet. The one in the middle is the most common one, which is the distal one. The only problem of that is that it's extremely painful for the patient and it needs to be repeated.
What would be your criteria?
This is the normal things that I would do.
How much we put on a wound if we decide to go with topical antibiotics. 50% of amputations after a diabetic for ulcer require BKA. This patient went to the emergency department. They did amputation of 3, 4, and 5 toes.
And there's a lot of friction, and I have had a lot of wound problems.
It's really a challenging. You try to explain the patient, you try to document them as much as you can about the benefits, about the options out there.
But this narrow area, it's very essential because where we stand, it has a lot of pressures. This is the first toy with exposed bones. So that's the product. It's from the live C-sections. Thank you very much. Wish you a very successful conference.
And we will start with Dr. Thomas. Dr. Thomas, he's a medical doctor in rehabilitation.
Arcadis method was invented in Poland, my country, with infectious, very strong ingrown tunnels on both sides. Also, both nail folds are pulled away.
Will this be treated as well by this Arcadis method?
We can learn you even in some minutes how to use. Of course, the more experience you have, the better you do it during the treatment. Thank you very much for your attention.
This is just a brief outline of my talk. I would like to discuss really the etiology, the natural history, and some of those of you who have been practicing in foot and ankle surgery or podiatry with flat feet and having concerns. So what I would tend to do depends on what the problem is. If they've got a lot of forefoot overload.
What kind of manipulation and what is the aim of this manipulation?
It's essentially like a reverse Ponseti type of technique.
Children with flat feet.
You mean which type of orthotic? I would say to a person, if they're going to wear an orthotic, I would usually use a lace-up shoe.
Thank you, Truman, really, for your lecture.
Pleasure. Thank you
very much.
So, our body has a similar structure. This is our jaw. This is our feet. Our muscles are also very important because they make our arches. How do you think, in which way our body has influence?
And all these make this kind of symptom to decrease. Did you hear about this or you know about what I'm talking about?
We would like to have a group photo and then go for lunch at the first floor. Thank you very much for coming.
Ich habe ein Zentrum für Osteopathie und Naturheilkunde.
I have a center for osteopathy and natural healing process.
Falsche Schuhe.
Wrong shoes.
Die Fersensporn kommt, entstehen Schmerzen und hier ist zum Beispiel eingeborene Defekt, wenn das ist Calcaneus extastose, aber keine Schmerzen.
No, say it show, a bone spike.
Good morning. I'm Elizabeth. I'm coming from the Netherlands.
It takes lots of time, lots of energy to learn ultrasound.
You have a protocol in this direction or not?
So then I already have a kind of document of the patient.
Is it a fixed point or it can be various?
It's completely depending on the structure and where the lesion will be.
Great. Yeah, my name is John Graham, and actually I'm a chiropractor from upstate New York. This is him back in the 70s. These two pieces right here are 16 inches thick of solid steel. Chiari malformation is called drop syndrome, where a person will go walking and they'll just flop. If you have any questions, feel free to, touch base with me over at the booth, and thank you very much.
I want to present now the lecture is for Dr. Russo Luca from Italy.
First of all, I want to thank the organization. I want to thank Dr. Mohamed Nouri, and I am very happy to be here with you today. So, We speak about foot plantar pressure analysis. So we have a posterior view of the foot during the walk, and we have the motion on the frontal plane. It is very important to understand what single limb stance represents. You can see from these three pictures that the medial, that the average line.
Thank you very much, Dr. Luca. Thank you.
Thank you.
Now we have a lecture for Dr. Noor. She is from Bahrain.
Diabetic peripheral neuropathy, which is also known as distal symmetrical peripheral neuropathy or polyneuropathy, basically relates to nerve ischemia, which is caused by mainly due to occlusion of the vessel. So as you can see in this image, this is like a segmental image of the vessel showing that occlusion of the vasa nervorum. Things like autoantibodies have been linked to the patients with diabetic peripheral neuropathy. It's usually the easiest way to detect whether the patient has neuropathy or not. And you don't see the small fibers in the neuropathic skin. We only see the tip of this iceberg. But the whole diabetic neuropathy is so complicated that I think there are so many aspects that are still undiscovered.
Yeah, there are a lot of studies about exercise.
But I think I related mainly to the improving your vessel supply.
Today all the lectures already done. We have practice in Wednesday, and we will make please picture now for the end of the conference. And thank you very much. Thank you.